Hi everyone, thanks for joining me today. I'm Dr. Christy Kesslering and I'm going to talk about metabolic health. We'll touch on why that's important from a cancer standpoint. I'm a radiation oncologist with Radiation Oncology Consultants. I practice at the Northwestern Medicine Cancer Center in Warrenville. I'm here filming at the Living Well Cancer Resource Center, and Living Well is a part of Northwestern Medicine and provides hundreds of free programs and services to cancer patients and their families. If you have any questions during the talk, please feel free to submit comments or questions in the comment section, and I will answer as many as I can as time allows. So just to touch on metabolic health, what is that? What does that mean? It basically is talking about how your cells operate. Do they operate efficiently? We have these tons of little mitochondria. There are little powerhouses within every cell, and that's what produces energy for us, and it uses different substrates to do that. When we eat food, those are converted into different chemicals and run through different processes. There's a number of things that actually damage our mitochondria. The longer we live, the more things that we're exposed to through our lives. There are things that really do a big damage to those cells, and those would be things like processed foods, sugars, grains, vegetable oils, things that are manufactured in factories, not the foods that are real, whole, single ingredient foods. Walk around the outside of the grocery store and look at those single ingredient foods. Avoid most of the stuff in the center and in the bakery aisle, which is also around the outside. Skip that. But other things can cause mitochondrial damage as well. Things, environmental toxins, exposures that we're, or toxins that we're exposed to in our environment, in our water, in our household products, in our food, if you look at ingredient labels, how many different chemicals might be in those, but even personal care products, our makeups, our shampoos and soaps and deodorants and detergents and cleaning supplies. There's a lot of things that are constantly bombarding our system, and our body is pretty good at fixing those things. But if we're exposed to them over and over and over again, then sometimes our body gets worn out and it just can't keep up anymore. Or if it's doing that, it doesn't have time to do surveillance. I always say cancer, we're all cancering every day probably, and our bodies are so good at finding those damaged cells, the damaged DNA, pulling out damaged and fixing those little damaged DNAs so that the cell can heal. And we have times when we do that, like in sleep and rest. And if we're going strong all day, staying up to all hours of the night and getting up early and going, we don't have time to do that repair. So lots of things can damage it. But even normal, what we consider normal medications and over-the-counter medications, some of those can cause some damage too. So really trying to optimize our health requires us really looking and doing a deep dive into all aspects of our living. So when I think about cancer and metabolic health, I think that the cells have worn out, that damaged cells have gotten through the system and have grown. So I always say it's like your check engine light going on. Look to see where can you improve, what things can we clean up. We think about cancer as a genetic disease, but in theory, only a very small percentage of cancers have an underlying genetic disorder. But even then, just because you have a genetic disorder doesn't mean that you have to get a cancer. It is not a 100% transmission rate. So why is that? Well, I think of cancer as more of an epigenetic disease, meaning that certain genes get turned on or turned off based on what is happening in our own internal environment. So there are things called tumor suppressor genes. Those we want turned on, right? Suppressing tumors. And there are things called oncogenes, things that grow or turn on cancer growth. So the more things that we can kind of keep in that healthy metabolism, we actually improve those in epigenetics. One of the things I talk a lot about is sugar and insulin and carbohydrates as related to cancer growth. So what we know is that many cancer cells have upregulated the number of insulin receptors and insulin-like growth factor receptors on the surface of the cells. And what do those things do? When we eat a carbohydrate-rich meal, pure sugar being a pure carbohydrate, but many things in our food environment are high in carbohydrate, then we get a rise in blood glucose, we get our pancreas dumping out insulin, we get insulin binding to those cells and letting sugar or pulling sugar into the cells to use as fuel. The cancer cells tend to use much more glucose than our normal cells. That's why they upregulate their insulin receptors to get more and more glucose. It's why when we do PET scans in cancer, when we inject a radioactive glucose, glucose goes to those hypermetabolic cancer cells. They light up like a Christmas tree. Insulin receptors also act to stimulate or turn on cascades of different hormones that can drive cancer as well. So it's kind of a two-pronged approach. Sugar acts as a fuel, insulin and insulin-like growth factor act as signaling molecules that can turn on the cancer for growth. So my bias is let's not do these spikes in glucose and insulin. Let's lower those. Let's decrease the chances or the times when that can actually happen. If you're eating from dawn until dusk or past dusk all the way till bedtime, and you're eating carbohydrate-rich meals, process is happening numerous times a day. The average American is eating 8 times a day. A little snack here, a little bite of something there. But if we can decrease the number of times that we're eating, called intermittent fasting or decreased eating window or time-restricted feeding, maybe we're only eating between the hours of noon and 6, or maybe we're only eating twice, noon and 6. Maybe we're only eating 1 time a day, but we're eating enough calories to sustain us. That has been shown to lower fasting glucose and fasting insulin. Carbohydrate-rich meals will spike glucose more. I'm a fan of everybody knowing what your meals are doing to you. Get a glucometer. They're very cheap, about $30 to $40 you can buy online or from your local pharmacy, and you can do a finger stick before you eat, maybe first thing in the morning every morning, before you eat a meal, maybe 1 and 2 hours after a meal. See what your blood glucose is doing during each of your meals. Just get an idea. Know your fasting insulin level. Ask your doctor for a fasting insulin level. Fasting insulin should be very low single digits. If it's higher than that, it means that your pancreas is so worried about the next shot of glucose coming that it's producing insulin around the clock. So the basal rate, that non-eating level, is higher. So where I think people should be, 3, many cancer patients are 8, 10, 20, 50, 80. So we really want to see those low numbers, and knowing what your own body does and tolerates is very personal. Everybody has different genetics, different environments, different food sensitivities, etc. So my bias is that if you can't just follow a diet per se. You can't just say, this way of eating is good for everybody. Because if somebody is following, let's say, a whole foods plant-based diet, it may still be too high in carbohydrate for that particular patient. Most patients, especially cancer patients, in my opinion, tend to do better with a lower carbohydrate diet. But a lower carbohydrate diet can be done in many different ways. It can be done as an omnivore, it can be done as a vegetarian or a pescatarian or Mediterranean or you name it. So there's lots of different options. But it's really about knowing what those foods are doing to your own personal metabolic health. And I always think that insulin is an easy check. If I had to say what are the top 5, 6 things to do, the first thing I would recommend to everybody is cut out the added sugars, the processed grains, the vegetable oils that are factory made. So things like soybean oil, which is in so many processed foods, corn, vegetable, safflower, sunflower. If it comes from what sounds like a vegetable, a nut, a seed, we really don't want those. If it comes from a fruit like olive, avocado, coconut, those are better oils for people. Personally, my favorite is butter, or ghee, which is clarified butter. Step 2, eat real food. Stop eating foods that come in boxes, bags, any kind of package. So if you're eating real, whole, single ingredient food, you're gonna likely do much better than wherever you're starting with. But then maybe there are some additional tweaks. Maybe you do need to cut back on other things, like maybe even some high carbohydrate fruits, vegetables, other types of foods. Again, read labels, look for additives, look for chemicals, look if it just says, for instance, pork, sea salt, and water, that's an okay sausage. But if there are 20 ingredients in that, it is really not something that we want to eat. Exercise. So there are things, different types of exercise that have been shown to be more improved insulin resistance. So just walking every day is great, but if you can do some resistance training, build muscle, improve the muscle storage capacity for sugar, you actually improve your insulin sensitivity. If you do some HIIT exercises, that high intensity interval training, which can be done as part of a resistance training program, that also has been shown to improve insulin resistance because you are improving, you are kind of depleting your glycogen stores, creating more room for glucose every day. Sleep. If you are sleep deprived, if you unfortunately have to work like a split shift, or every few weeks you have to work late, that is actually shown to increase insulin resistance. It causes the next day to be a tough glucose and insulin day where your body starts craving crappy food. So we don't want to do that. We want to keep ourselves in a really good sleep pattern. So the more you can follow an early to bed, early to rise type of a pattern, the better off your glucose and insulin sensitivity is. Sunlight. Get out in nature. Exposure to sunlight improves our vitamin D. Low vitamin D is often associated with insulin resistance. So if we can get good vitamin D, there are some foods that can improve vitamin D, like fatty fish, even pasture-raised eggs, and grass-fed beef. So there are some ways to improve naturally vitamin D, but there is no replacement for the sunshine. It doesn't mean go out and lay out for 5 hours and get sunburned. It means get a healthy tan, out for a few minutes, back in, whatever it takes to improve, to get a tan without a burn. And then stress. Stress is a big one. Stress is, one of the big leading sources of insulin resistance, as well as cancer and heart disease and everything. So we really want to work on how can we improve stress. And there's lots of different things. Maybe we need to get out of certain relationships or friendships or things that maybe are more stressful than they are helpful. Everybody is coming from a completely different place, and so those stresses are different to every person. But the more you can work on yourself and maybe identify some areas where you can make some improvements. It's why things like meditation and yoga have done such a great service. It's been shown in many studies to improve many chronic conditions because you're addressing that stress and you're giving yourself that rest, that time when we actually repair our bodies. So sleep, stress reduction, exercise, sunshine, and control what you put in your mouth. That is a great start. If you don't have your cells stressing out about what you're eating, it has time, your body has time to really help and repair the other things that maybe are less or more difficult to control. Okay, we're going to answer a few questions.
So Anna is asking, her and her husband have been learning a lot about the ketogenic diet, and it's been great for weight loss for them. They're struggling with constipation. What are some ways to address this?
Okay, so for those that have tried a ketogenic diet or are doing a ketogenic diet and are having troubles with constipation, there are a few things. One, make sure that you're getting adequate salt and adequate magnesium, adequate water. I usually recommend salting your foods liberally. Taking a magnesium supplement can help. Sometimes actually reducing some of the fiber in the diet temporarily and increasing that a little more slowly. Many ketogenic diets can be very high fiber diets depending on how many vegetables, nuts, seeds that you're including. So you might want to cut back on the high fiber foods and then make sure that you make sure you're getting adequate fat. There is just a resource online, dietdoctor.com, on their frequently asked questions page. They also do have frequently asked questions, and one of them being constipation, so you can look at that as well.
Jessica's asking what your thoughts are on metformin and cancer.
So thoughts on metformin and cancer? Great question, Jessica. So metformin is a drug that actually suppresses your release of glucose from the glycogen stores in the liver. When your glucose is suppressed, you are also then suppressing that insulin response. So there are some studies that have shown that there is some improvement with metformin. So if you, let's say we took all the diabetic patients that tend to have high glucose and high insulin, those patients that were on metformin did better than those who were not. My bias, though, is that I would rather you just not eat the glucose and to deplete your glycogen stores yourself with diet and lifestyle than taking a medication that can have some temporary benefit or benefit, but it's also known as a mitochondrial toxin. So if we're on metformin and yes, we're helping the glucose insulin, but if we're damaging more mitochondria along the way, we may not be doing ourselves the longer service.
Do you have recommendations on how people can determine what is a reasonable weight or a weight goal?
So the question is about a reasonable weight goal. So I don't look at it as weight, because if we look at cancer patients, they're not all heavy. Obesity is certainly a factor, but is it obesity itself, or is it because those patients have high glucose and high insulin levels? And we have very thin patients who are diabetics and or cancer patients. So my main goal is to get people metabolically healthy. Many times weight loss will go along with that. But I do have the occasional patient who doesn't just drop weight like you hear I just dropped 300 pounds by going low carb or whatever. Some people will lose some weight and some people will not lose weight. But if their metabolic markers are improving, that's my first goal. I want to see those markers improving and knowing that their cells are functioning better. Then there are other things that we can do to kind of tweak weight loss if that's the goal, or increase weight for some people who are thinner. But I would say that, BMIs are terrible. They're not terrible. They're just somewhat deficient, meaning that all they're looking at is height and weight. They're not looking at how much of that weight is fat mass, is intra-abdominal fat mass, is muscle and bone. Obviously, two people weighing the same can look completely different based on their lean mass and their fat mass. So I'm really more about measurements. How are clothes fitting? Are you shrinking if you're trying to lose weight, even if the scale isn't moving? I have had patients tell me that they've lost multiple sizes with the scale not budging one bit. So it's really about body composition and cellular health. And I don't think there's a right weight for any particular person. I think our genetics are going to play into that. We all think of subcutaneous fat as this ugly, terrible thing, but it's actually quite protective. It's when we are having this glucose and insulin spikes, that we have a place to put the glucose. So the glucose gets turned into triglycerides, fat stored into these cells, and those cells expand. So our fat mass expands, but we might still be metabolically healthy because we're able to deal with that glucose and insulin rise. If we are no longer able to deal with that, regardless of the amount of subcutaneous fat, so maybe thin, maybe morbidly obese, or maybe just a little bit overweight, and all of a sudden the wheels start falling off because our metabolic health is suffering. So looking at somebody on the outside doesn't ever really tell me how their metabolic health truly is on the inside. Certainly with other diagnoses, you can make a guess that things aren't working well, or that they're on a path to ultimately losing that ability. But I don't think that there's a perfect weight and for any shape or size, but we're always looking to build lean mass and improve metabolic health.
Could certain medications affect metabolic health? And if so, what are the top ones that-
So can medications affect metabolic health? And we touched on metformin, but there are a whole host of medications that that have been shown to be mitochondrial damaging drugs. And you can actually Google those online. There's a number of papers that have been written about them. And I don't know that I have any that's like, this one's absolutely terrible and this one's only kind of terrible. If they're damaging DNA or damaging mitochondria, they're damaging mitochondria. I would just personally stay away from as many as I can. I tend to try to omit as many medications, even over the counter. If you have a little headache, is there another way that we can deal with that? Is it just a little dehydration or not enough electrolytes or something that we can deal with in a more natural way than actually taking an over-the-counter pain reliever or something like that. So again, my bias is just minimize the medications that you're on to the best of your ability.
You talked about what to cut out from a food aspect and what to start eating. Are there any special precautions that need to be considered when somebody starts going down this path?
Repeat that again.
You talked about what foods to start cutting out.
Right.
For healthier metabolic health, and what foods to start eating.
Right.
If I go down this path, is there any considerations I should be aware of? Like I think about the question about, being on keto and constipation.
Yeah. So not necessarily. So I think the question is really about, what things we should be thinking about as we're transitioning diet. I think that if people transition very slowly, sometimes that's harder. Harder in that I always feel for some people that works great. Cut this, cut that, move on toward getting better and better and better about your food choices. Some people who are in that very high sugar demand metabolism, that they feel terrible for a long time because they haven't transitioned into a true fat burning ketogenic metabolism, and so their body is still telling them to give them glucose. So they're in kind of this purgatory. They're not giving themselves enough glucose to live in that glucose burning system, but they're not giving themselves a low enough carbohydrate diet to get into that fat burning system. So there are some of those things. There are other things. It's called the keto flu. When you go kind of full guns, which is what I do recommend for some people, you get rid of all of those carbohydrate-rich foods, and you are eating mostly above ground vegetables, maybe some nuts and seeds, maybe some berries, and then your animal proteins and fats. And because that body is still looking for that sugar load that it's not getting, it does kind of go through what I consider to be a carbohydrate withdrawal. And it's just getting that body into the proper mode. And most people will only suffer through that for a few days, if at all. Most don't. But if they do, it's a little bit concerning. Some people that might last for a week or two. There are some products on the market now looking to try to mitigate some of those symptoms. My bias is you can, again, if that's a real problem, you can try to do it more gradually and see if that's a better approach for you. Most people do not have that, and so it's a quick transition. I think that's, and the keto flu, meaning fatigue, lethargy, headache, just not feeling great because you're not giving your body the energy that it needs, but it will get there. Some people start making ketones. Body uses ketones as fuel. Your brain loves it, which is why most people say they get this really alert, focused, able to work better type of a brain, as opposed to being in a brain fog. The other things, you can have some constipation or, again, the reference that I gave before, diet doctor, frequently asked questions. There's quite a number of kind of potential issues that people have run across when they've transitioned to this way of eating, and they give some solutions to those things. I usually say make sure you're hydrating, getting plenty of salt and magnesium. That's kind of the biggest thing. And then just let your body do the work, because once you're on the other side of that, most people are like, this is amazing. So again, not everybody is. Some people need some additional help, but most people get there pretty easily and then feel pretty good.
Sue is asking, she's on chemo and plain water just doesn't taste great. Is adding water enhancer such as Crystal Light or Mio, which has aspartame, a good choice to help maintain hydration?
Well, I would certainly say that in a short term, if you needed to use those products, that would be okay, although those wouldn't be my favorite products. I would say trying just to go to some of the waters that just have a hint of flavor or some natural flavorings might be a better option. There are also some flavor enhancers that I've seen, True Lemon, True Lime, True Grapefruit, I think, that are just the kind of dried fruit, citrus to go into the waters, or even just putting squeezes of your own fruits, or doing some of the infused waters, taking your water jug and filling it with some strawberries or cucumber or mint or something and kind of getting that infused taste. Might be a good alternative, but I think it would be experimenting on your part. But I would still say that doing a little bit of Crystal Light or Mio would be, lesser of the evils, as opposed to actually drinking a juice or something like that. But again, not usually my first choice. Something more natural would be ideal.
I think last question, what are your thoughts on supplements and herbs?
Great question. So for the most part, I am not a huge fan of supplements. I think there are some that can be of benefit. I think that many of our supplements are and like vitamins and such, they're just things that maybe our body doesn't recognize the way we think they should. Most vitamins and minerals, in my opinion, should be obtained from food. They come in a big package that the body understands. When you're taking a synthetic vitamin, I'm not convinced that our body recognizes that in the same way, and it may actually be causing more harm than good. I don't like necessarily people taking supplements for things that they just think might be better. We don't know that they're deficient in a particular substance. I think that there are mixed reviews. There are some, for instance, like turmeric or resveratrol or other types of anti-inflammatories that maybe in a cancer study looked to show improvement. Many times my bias is if you can get yourself into a better metabolic state. So when you're eating poor foods, creating what we call reactive oxygen species, which is basically like, the exhaust from your pipe, now your body has to use up its antioxidants to clear up the exhaust. But if we could just choose foods and drinks and lifestyle choices that don't create as much of that exhaust, we don't need to use up our antioxidants for that. We can use our antioxidants to help us with cancer. So I think that some of those studies, although in a setting of nobody changing their diet and lifestyle and just being given an antioxidant, maybe there's some slight benefit. But I'd rather see us improve our underlying metabolic health to better able to take care of all of that ourselves. Our body is really a miraculous healer. We just have to give it a chance. Thank you very much. If there are any other questions, concerns, I'm sure you can reach out to Living Well. If anybody wants more information on metabolic health, you're more than welcome to contact me. I do see patients to discuss their own metabolic health. I also do a monthly support group that's been on COVID hold for a while, but typically it's the second Wednesday of every month at 6 p.m. to 7 p.m. at the Warrenville Cancer Center campus. And you can always call our office to find out when we're back on. And we're hoping to be, I don't know if it's going to be July or August, but fingers crossed that we'll get there soon. Thank you very much, everybody, and have a great day.